ultimately, we are planning on leaving Alberta, which is devastating for me.
Packing up and leaving the province, doctors across Alberta light up social media with resignation letters saying they're leaving the province for greener pastures. But that green doesn't necessarily mean money.
I suspect I will make less in BC. I don't know for sure since I haven't worked there, but I suspect that's true. But we are really looking for a better relationship and more stability.
Alberta-born and raised Dr. Alana Bowie joined the Moose and Squirrel Clinic in Sundre this past year, thinking she would be there for the rest of her career. But this past month, she was one of 5 of the 8 total physicians working out of the clinic to resign. She says it's due to the UCP government.
So when they tore up our contract earlier this year, we are now working as contractors without a contract. So that obviously creates some instability within our workforce. I really don't like where the government is going in terms of de-emphasizing primary care and then denouncing care for more marginalized populations. So having seniors pay for drivers' medicals, or Kenny had made a comment about harm reduction not working.
On Twitter, several Alberta doctors are getting vocal about leaving the province. One likening Alberta healthcare to a dumpster fire, saying she's voting with her boots. Another, Dr. Don Wilson, says it's about standing up for rural healthcare.
The denial of access to healthcare to rural Albertans that will result in harm. That is the real reason why I'm leaving in protest over those decisions, because rural people are going to pay some really serious prices. With either worse health outcomes or even deaths.
In July, results from a survey by the Alberta Medical Association showed that 87% of physicians were making changes to their practices due to the funding framework put in place by the health minister. And 42% of Alberta doctors were considering looking for work in another province. The Premier doesn't seem worried.
According to the College of Physicians and Surgeons, there is no evidence of an increase in the number of physicians leaving service here in Alberta. And I really have to ask, why would a physician choose to leave Alberta to go to a province where they would be paid substantially less?
The climate in British Columbia is, when I went there and worked for June, July, and most of August, or a good chunk of August, it just felt like 1,000 pounds had been lifted off my shoulders, knowing that I was not dealing with that toxicity from the government towards our profession.
In Calgary, Tara Overholt, City News.